and welcome to another wellness episode of ANOKHI Daily Spotlight TV. Today we're going to be talking about cervical cancer and what you can do to protect your health. To do this, we've been joined by Dr. Nasreen Ramji. Thank you so much for joining us, Dr. Ramji.
Thank you so much for having me. It's my pleasure.
So I think most of us know what the cervix is, or at least we think we do, but can you kind of peel us back a little bit, take us through the basics and talk about the cervix as well as what cervical cancer is?
Sure. We most often hear about the cervix when a woman is pregnant and in labor, right?
Mm-hmm.
The cervix dilates. But cervix is actually a tunnel between the uterus and the vagina.
Mm-hmm.
And the cells of the cervix change over very quickly.
Okay.
With that quick change, there's a risk of a mistake happening. So when the mistakes happen, changes happen to the cells,
Right.
and that can lead to cervical cancer.
And so in order to determine if there are any irregularities in the cells, is that kind of where the pap comes into play?
Yes, that's exactly what it is. The pap actually tests for cells changing. So we take a sample when we do your pap test of those cells and we look at them under a microscope.
Okay.
And we just see the degree of change that's happened to those cells. Most of the time there's no change. And some of the times the change can be quite a lot more significant.
Okay.
And that's when we do further work.
Right. So Dr. Ramji, when we were speaking earlier, you mentioned something that was actually pretty surprising and somewhat alarming to me, and that's that South Asian women tend to have the lowest rate of pap tests done?
Yes, in a survey of South Asian women across North America, it indicated that only 3/4 had had their regular pap screening done.
Really? And is there a reason for this?
Well, they cited a few reasons. Usually it was low knowledge about the pap test.
Okay.
And then on top of that, barriers included a fatalistic attitude. So basically, back home, because of lack of early detection, cervical cancer is fatal.
Right.
So a lot of women are afraid. So that's one of the biggest barriers.
Okay.
Preconceived notion that women who get cervical cancer are promiscuous.
Right.
And that's not entirely the case.
Right.
It can be from one encounter that you could get HPV. A lot of women don't have time. They're fulfilling so many roles in their family.
Right.
They're caregiver, they're worker. They just don't have the time to take care of themselves. So
Right.
I'm glad we're doing this today.
Good, absolutely.
And the last reason is that they may not necessarily be comfortable with the exam. So it's a simple test, but have a family doctor. Have someone that you know and trust to do the procedure for you. And that can help as well.
Okay, so the South Asian women who are watching, mandatory to get that pap test done, right? So Dr. Ramji, many women think that we need to get the pap done annually. Is that actually the case?
Not anymore. It used to be, but now the guidelines suggest that we get the pap done every 3 years.
So a little bit more lax then.
Absolutely. As long as you've never had an abnormal pap before, every 3 years is fine enough to detect those changes that we talked about.
Okay, great, yeah. Dr. Ramji, this has been so educational for me. We now know what the cervix is, what the pap test is, and how frequently we need to get it done. But can you talk to us a little bit about any tips or words of wisdom that you have for any of the women out there who might still be uncomfortable with taking the test?
Absolutely. The easiest thing you can do is take an Advil before your pap test.
So easy.
Yeah. And that helps to alleviate some of the discomfort of inserting the speculum into the canal while we're doing the exam.
Okay.
If you're still uncomfortable, you can also ask your GP to use a smaller speculum.
I didn't even know that there were different sizes.
There are.
Okay, and is there a way to ensure that we get like the best possible test done? Like a clean test, the best response?
Absolutely. What we do recommend is that most women get their pap test done 2 or 3 days after their period.
Okay.
So they get a nice clean catch. We recommend not having intercourse or using tampons before the pap test as well. And finally, tell a friend. This is so important for our South Asian community. Once you've had your pap, tell your mother, tell your sister, tell your cousin.
Let's get that awareness and those percentages up there.
Absolutely.
And are there any other recommendations or references or tools that you can provide the viewers out there if they have any questions or additional concerns?
On the Ministry of Health website, they have a great tool called Screen for Life,
Okay.
where they guide you through breast cancer screening, cervical cancer screening, and colorectal cancer screening. So that way you can find out when you should have these done.
Okay, get more information and read up on it if they have any other questions. Dr. Ramji, thank you so much for this really insightful discussion. I know all of us learned so much from you today. I'm going to follow up on your final tip and tell all of you out there to please go and get a regular pap test done. Protect your health. For more of our show, catch us on ANOKHImedia.com and our YouTube channel, and be sure to interact with us on Facebook and Twitter. See you next time.